Welcome back to the studio on day two. We're into the afternoon session now on day two of London Calling, and we're here in the studio to talk about breaking down barriers in genomics. And thank you so much to my guests for taking time out of their day. We have Javeria, Ariana and Thomas on the sofa, Javeria, sorry, to talk about how we get this technology to more people in more places. And we as a company really believe that we want all communities who need and would benefit from access to this technology to have that. And we've designed our products to be portable and low cost and easy to use. We've designed our service model so you can get a lot done online. But there are still so many challenges in bringing this technology to those communities. So I'd love to have this conversation with you guys today. First of all, can I ask you each to just talk about a little bit about the work that you're doing? Ariana, you first.
Thank you so much. So we work with infectious diseases and point-of-care diagnostics, so communities that have maybe not the highest resources. And so we have a lot of partners who are involved in the different projects, and we try to do some capacity building, meaning that we take a mobile suitcase with technologies such as Oxford Nanopore into the field and do the actual research with people and staff on site. And so for us, the capacity building aspect is really important in our infectious disease work.
And do you get brought into situations where there's something sort of emerging, or are you on a sort of always-on basis?
Yes, exactly. So we try to have, trained staff that in turn train their staff to have, people ready for whenever, an Mpox outbreak happens, and we want to dive into it with our mobile lab. So yeah, we're ready to go, basically.
And which countries are in your network?
So we do mainly sub-Saharan African countries, but we have partners in Southeast Asia as well, some in South America. So we're trying to, have a nice set of partners that all know each other, and which also eases, let's say, the translational part of the technologies and the things we use.
Javeria, how about you? How's your network, and what's the work that you're doing?
So we've been partnering with St. Jude Children's Hospital and University of North Carolina to kind of validate nanopore sequencing for pediatric acute leukemia. So we are trying to determine its performance or accuracy against some of the standard diagnostic tests that are already available at our facility. And the idea is to have a single unified test at a lower cost that can potentially solve some of the problems that we have in our setting with the standard tests.
And what are some of those problems that you have in that setting?
So I think the biggest one is, apart from cost, there's also different kinds of supply chains that are required for each of these tests. And then all of these tests are classified as high complexity testing. And so you need a lot of training, technical expertise for these, and with a lot of these we have problems because we have very high turnovers for staff and then long training requirements, and so there's a lot of inertia implementing these tests and making them accessible to a lot of sites in Pakistan.
Fantastic, thank you. And Thomas, tell us what it's like from your perspective. You're working in North Carolina as a hub of an international network. Share your work with us.
Yes, so in many ways, I'm an encourager or a cheerleader of a lot of the teams internationally that are doing the sequencing. And so I work closely with St. Jude Children's Research Hospital and some of the members of their global alliance, including Dr. Javeria, to try to bring the technology and science of sequencing into low resource settings. I think for so long, up until the last several years, this felt almost irresponsible to do because there were so many other challenges, and the idea of very technically complex or maybe very expensive sequencing was felt as an irresponsible or not something that was appropriate. I think opportunities like Nanopore that are more cost accessible and very well developed now as far as the technical components change the conversation dramatically. And so we're trying to work with a large network of hospitals to, again, help support the teams on the ground access the technology, focusing on pediatric cancer.
Got it. So you're each working within networks. So what are the benefits of the network? Why is it better to have multiple parties in multiple countries potentially rather than just individual centres?
Yeah, so I think we're learning a lot because obviously each situation is a bit different. So that's the first thing, and what Javeria is teaching us from Pakistan, and then teams from India and Brazil, they have different challenges. And then the opportunity to bring all of that together to advocate uniformly with ONT, with governments. I think that pooled momentum and pooled advocacy is critical, and we're already seeing some of the changes that's been able to bring.
So, Javeria, what kind of problems are you solving when you do reach out to other people in the network? What have you shared with them, and what have they shared with you? What kind of problems have you fixed?
So we're talking about the network of collaborators across the world. So I think I don't see any particular problems. We've only had advantages in terms of learning, in terms of capacity development, and also I think in terms of advocacy, which you just mentioned, because for us to be able to talk about it and convince other people, we need to tell that, okay, it's not just us, it's being implemented in so many centers across the world. It's also good for us to get better pricing. The higher the throughput of tests, the better you can convince in every way. So I don't see any obvious disadvantages. The only thing is the regulatory aspects of some of the transfer of data and samples and all of those aspects that need to be.
So I think I'll just jump in. I think Javeria is being very humble, right? So the problems are supply chains and working with some of the third party that she's advocated for and taught us, the training that she's gone through, and now we meet as a group sometimes, and she's a peer mentor to other different sites, setting up lab validation. She's leading what a clinical validation should be for the entire conversation. So all of these pieces are problems. Maybe to Javeria, they're opportunities that she's solving, but I think
fantastic.
She's bringing a lot of that.
Fantastic. And how is that translational pathway? Where are you on the journey between discovery, method development, and implementation?
Yeah, so I think, so we are an accredited lab with College of American Pathologists, and so my ultimate hope and goal is to be able to come up to all of the standards that CAP requires, and and then to have it implemented as a clinical test. So how long will it take? I think because sequencing is much more of a complex test than any other pathology test, I would say, and so I think because you have to look into a lot of variables, and especially if you are validating it against so many different tests. And so I think, so we are at the stage of, determining its accuracy against one test. But then after this, we want to go to other tests. And I don't see it at least within this year. It may take a couple of years before we are able to, have some sort of good data.
Thomas thinks this year.
Yeah, it depends upon which assay we're talking about. I'm optimistic with some of the talks we've heard here and that we're working on and that Javeria is doing, that certainly in next year we will be able to have some of the adaptive whole genome clinically validated for pediatric leukemia. That's
amazing. I've heard some people talk about it being an advantage sometimes to be in a resource-limited setting when there is a bigger driver for solutions, and people with really powerful drivers can make things happen faster, perhaps even than in more developed countries. Do you think that's true, or...?
I think it depends on, so we want to balance caution against ambition. So I think, especially if we are doing it for a clinical test and not as an add-on, we want to de-implement the other tests. So we really have to be cautious not to, compromise some of the, because I think with the tests that are already there, the performance is accepted, and you have to come up with something better than that to be able to, replace. Even though some of them may not perform so good currently, but it's just that they are accepted, and so that's why I think, take it so that, bring that acceptance in people, and then maybe de-implement the rest, and
move quickly but carefully. Fantastic. Well, we were talking earlier, Ariana, about the challenges that you face around getting technology to people in all of the areas, and we were having a really interesting thought around, obviously, Gordon in his early opening talked about the computational power that is developing every year, bigger and bigger. But we were then also talking about the power of logistics networks growing faster and faster, and that sort of last mile delivery being an orthogonal industry that potentially could help us get technology to people who need it. So what are the kind of challenges that you've faced in logistics, getting the technology into the places it needs to be, and how do you think we could push through that?
Yeah, difficult question. Logistics and essential, unfortunately, for everything to happen. I just want to add on the partnership aspect here, because in having such partnerships that actually work together since a longer period of time, you also can bypass logistics and make them more effective. So you can, have neighboring countries, you have people who come from that conference to that conference who know it. Like, you can recycle those, let's say, connections and pathways also to increase the logistical aspect, to make it more easy to get one thing to A to B, right? So that's something that I strongly believe in, that it's also for logistics very important to have partnerships that are long-lasting. And then, there's the customs issue. There's things that you need to take into account, but that you can navigate if you have people on site who know how to navigate them. So you need people on site to make it happen. Yep. Definitely.
When you're going from to your rapid response, are you taking the equipment in a bag with you or a pack, or are you can't rely on third parties to source it, I guess?
Exactly. So it's very different according to the setting that we're going to. So sometimes you're included in a public health agency, so they do have some basic, refrigerators and so on. Sometimes you're in the field under the hot sun, so you need, solar panels to make it work. So very different. Usually we try to take everything that's needed with us. So, everything's in a box, basically. But you do rely on people on site who give you the tips and tricks and how, you need that cable, you need that people to do, so you need to work together, but we try to bring the essentials for the wet lab and the dry lab. We take it with us. And some of our partners, they already have the mobile suitcase lab on site, so we don't need to bring everything. So if we know people on site that you work with, they also already know how to, how to be prepared. So recycling.
How do you think about
upcycling,
skills development on the ground? Probably that's a question for all of you. Skills development so that in the region you make sure that this is a sustainable innovation that you're doing. Do you have programs around building that into part of the capacity?
Yeah, so I think especially for the wet lab, it's important to train the youngsters to have them involved since the very beginning, because by experience they're very keen to learn all of these technologies. So we should get them early so that they can continue and be on site and do the stuff they want to do for themselves and for their research groups that will be coming up. So I think the youngsters should be also heavily involved.
I think it also depends on the pre-existing infrastructure, because that varies a lot from institution to institution. So like, let's say in our setting, if you already have a molecular lab and staff that are doing molecular testing, it's not that difficult to, train. But if you're starting from a place that doesn't have a molecular lab, is not doing even PCR, then you're talking about another dimension of, training. So, so I think it really varies.
Yeah, fantastic. How do you think about sort of resource deployment if you're sitting in the centralized lab? Do you think about resource planning when you're in a network setting?
Yeah, so one of the pieces of our conversation is all about cost comparisons and cost effectiveness, because if it's not scalable and it's not sustainable, then what are we doing, right? And so I think thinking about that a bit earlier in the process is quite critical, as opposed to building a full test and then thinking about scalability.
Fantastic. Well, I really wanted to ask you about your dream for the next 5 years, but apparently we're out of time because someone is about to walk on stage on the auditorium. So thank you so much for sharing your thoughts with us.
Thank you so much.
And we're going to go now live to the next talk in the auditorium. So hope you're ready for the next wonderful wave of science coming your way.